Good evening and welcome to an episode of Fresh Natural Live. It's a rare live episode. As of the holidays, we've been mostly in recording. And I wanted to come on tonight to share with you some information about some unfortunate news I heard from a friend of mine. I was here late doing some work, and a friend called me and asked me about a player who suffered a collapse on the field, a player by the name of Damar Hamlin, who plays for the Buffalo Bills, I recall. And so as my friend was describing things, to me, I went and looked at some videos and saw what happened. I thought I'd go on and explain my opinion, give my opinion in terms of what may be going on, because what probably happened is related to a condition that we refer to as Commotio Cordis. And I'm going to get into some details about what can cause a young athlete, a young person to collapse on the sports field. What is this condition of Commotio Cordis? I think this is going to be very important for us to know, so just hang tight. Hello again. As I said at the outset, we're going to talk about this issue of what appeared to be a cardiac arrest or a collapse of a player on the football field. The preliminary reports I received from the news reports and some of the videos is that the player collapsed immediately after making a tackle. He was hit in the chest. I'm told that they were performing cardiac resuscitation efforts on him, including defibrillation. And so this whole issue of cardiac arrest, I think, is an important issue for us to talk about, not only from the standpoint of NFL sports, but athletes can have a cardiac arrest in other sports. And there's some conditions I want to talk to you about that's related to young individuals who are physically fit, who seem to have normal hearts. But there's some fairly, I don't want to say rare, but some unusual conditions. And there's one in particular I want to highlight, was a condition known as Commotio Cordis. We're going to get into that. So let me share a few slides with you that I think would be helpful in terms of understanding this concept. So cardiac arrest in young athletes, how should we prepare for it? And I'm going to briefly throw a few slides to give you some basic definitions and give you an understanding. Sudden unexpected cardiac, I put in arrest here. Cardiac death is a term that we use in cardiology, electrophysiology. It doesn't mean the person has died, but when someone collapses suddenly, the heart stops, we refer to that as cardiac death. It doesn't mean it's irreversible death, but it's just medical jargon. So I put in here parentheses arrest. So in the sense of a collapse or cardiac arrest that happens in a young person, what are some of the things we think about in general? There are some general heart conditions that I think it's important for us to at least know about or be familiar with. There's a condition known as hypertrophic cardiomyopathy. Now, some of these terms are very, long medical terms, and I'm going to explain them as we go. Hypertrophic, basically, is thickening of the heart muscle. Anomalous origin of the coronary artery. That's the coronary arteries there's one artery comes from one side of the main branch of the aorta, and the other coronary artery branch come off the other side. Sometimes you can have one artery that's supposed to come off the right, come off the left, and they can twist around to the right, can kink. Many of you who are old sports fans like myself may be familiar with a basketball player named Pistol Pete Maravich. Pistol Pete Maravich was an NBA great point guard. He played with the Celtics and a number of other players, was from the New Orleans area. And he actually had a full basketball career, retired, and died suddenly at the age of 44 playing pickup basketball and the autopsy showed they had an anomalous origin of coronary artery. So this is a famous person who had this condition. Arrhythmogenic right ventricular cardiomyopathy, again, that's a mouthful. Essentially, that's an abnormality. We have fat infiltration of the heart muscle. Typically starts on the right side of the heart, the right chamber, but it can involve the entire left chamber. There could be electrical abnormalities, congenital electrical conditions known as prolonged QT, and catecholinergic disorders. Now, again, these are a mouthful, but again, these are just electrical abnormalities that can exist. If we were to do an X-ray or an ultrasound or angiogram, you would not find these things. Many of these things can be found on EKGs, but sometimes EKGs could be normal. And then polymorphic VT, again, these are just electrical things. So these would be findings that can be found in genetic testing, sometimes biochemical testing. So these are general types of disorders that can be associated with cardiac arrest in a young, healthy person who doesn't have known heart disease. However, what I want to talk about related to Damar Hamlin's collapse is following a blunt trauma. So when you have cardiac arrest or somebody who collapses following blunt trauma, it could be due to a condition known as Commotio Cordis. So what is Commotio Cordis? It's a phenomenon when you have sudden blunt impact to the chest and it causes a cardiac arrest, and it's associated with trauma. It could be mild trauma. It could be a baseball that goes to the chest. It's usually a small, dense object, but the person collapses, become unresponsive, but they can be resuscitated if they do CPR immediately and you have a defibrillator on hand. You can shock the person out of the arrhythmia and the person can be resuscitated. So here's some of the mechanisms, Commotio Cordis. Now they have here a diagram of a baseball. It's usually a small, dense object. It has direct impact on the chest over the heart, and the timing has to be right. Now here's an EKG. Now, maybe you may not be familiar with EKG. These are electrical signals. There's a P-wave electrical signal from the upper chamber, and this is the electrical signal from the lower chamber. And when the electrical signals go back to normal, we call it repolarization. And if you have blunt trauma to the chest during the time that the heart is trying to settle from an electrical wavefront coming through, so an electrical wavefront comes through the upper and then the lower, and then here's the electrical circuit that's settling down. When you have that, if you have blunt trauma, that occurs during this time, it can trigger electrical disarray. Notice here you have organized electrical signals here, 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 here. You have blunt trauma that comes here right at this vulnerable period. Then it sends it into electrical disarray. And I'm going to show the video of that tackle and explain why I think this might be a consideration as to what may have happened. And I think they did CPR and started doing defibrillation therapy, which I think is the appropriate thing to do. Here's a little bit more mechanistically. You have an impact of an object. It can be relatively small in diameter. It doesn't have to be velocity about 40 miles per hour and direct impact. And I'm going to talk about this 40 miles per hour in a minute. Chest wall variables, greater compliance, thinner chest, location directly over the heart. So here you have the rib cage, impact directly over the chest, focal ventricular depolarization. Now, these are medical terms, but essentially you're punching the chest directly at a vulnerable time during the electrical circuitry of the heart. And when you do that, you can have effects on what we call electron channels, like potassium channels, which affects the electrical circuitry of the heart. It causes some stretching and relaxation. So it has a mechanical force that then translates into an abnormal electrical circuitry or electrical short circuiting in the heart. So that can happen right across the chest like so. And then that sends the heart into what we call ventricular fibrillation. Essentially, that's an electrical short circuit where the heart's not able to beat in an organized fashion. It goes from beating organized fashion due to a normal electrical circuit. And when the electrical circuitry is thrown off, then it fibrillates. If it fibrillates, the blood doesn't circulate, blood pressure collapse, the individual collapses. So what you have to do is you have to get an electrical device, or electrical defibrillator or paddles, to shock it to reset the circuit and put it back in normal rhythm. That's the treatment of choice. But the key is to recognize it early. So here's an example. Source of the blow could be a hockey puck, lacrosse ball, baseball. They've seen samples. A fist or blow. There have been samples where in karate, kids are in karate competitions and somebody gets a blunt blow to the chest. The kid collapses. If you're alert and you're thinking about this, when the kid collapses, hopefully you have an AED on the spot. Immediately go out, start CPR, start AED, and you can resuscitate the athlete. So essentially here shows the impact, go right into the heart sits right there behind the chest wall, and that mechanical force at a critical time causes electrical disarray. So hopefully this slide helps out in that. I'll try to expand a little bit more. Mechanical stress here causes electrical abnormality that throws it into ventricular fibrillation. So what I'm going to do is I want to share this video with you and share why I think this Commotio Cordis is a consideration. And I see some comments in the channel as a report of it being CPR being done for 10 minutes. I'm going to try to stop this at a critical time. So let me just share. I'm going to put this on mute so I won't have the commentary. So just hear my commentary. There you have it right there in the chest. Now notice his shoulders right there. And it's not a good view right here, but on another view, you see that shoulder, or at least part of that shoulder is in the chest area. Okay, right there. Now, he gets up. Now, he could be in an abnormal heart rhythm right here. I've seen many people. I'm an electrophysiologist, and I'm a heart rhythm specialist, and I've treated thousands of patients with heart rhythm abnormalities. And one thing we do in an electrophysiology lab, when we're testing individuals for the risk of cardiac arrest, what we do in the lab is that we put them in cardiac arrest. So I've seen, hundreds of patients go into cardiac arrest. And one thing I've noticed in the context of it, and this is a controlled setting. Obviously, you don't do this in the regular doctor's office and in the regular lab. We have defibrillators on the chest, defibrillator pads, and everything ready. But we pace the heart in a certain way, or sometimes we'll shock the heart right at this vulnerable period to put the heart in cardiac arrest. Now, we do this in a controlled setting to test devices, ability to terminate a cardiac arrest or the like. So in the cardiac electrophysiology lab, I've seen many individuals who go into ventricular fibrillation arrest, and early on, they have a blood pressure enough to be alert and talking. And so, and it's possible that he went into ventricular tachycardia, then ventricular fibrillation. So he could have been in a ventricular tachycardia first, then it could have degraded to ventricular fibrillation. So even though you would think that after the blow, he would collapse suddenly, it's possible that he had, after the blow, he's in an early arrhythmia that's enough to where he's awake and alert and can even stand up. However, he can still then degenerate into the cardiac arrest. So we'll watch this. He stands up. Now, he doesn't look quite himself, and he goes out again. And so he goes out for the first time and once and until CPR started. So he's out right here. Now, that's the blow. Look at that blow right there. I'm going to take it back a little bit. Okay, I'm going to stop it right there. So you can see right here, it's although his elbow covers it, that shoulder is right in the chest area. And it's certainly at a position where Commotio Cordis, and you can see it better right there. That shoulder's right there. He moves over. And the tip of the shoulder pad can be sharp enough to cause the right type of blow, or the wrong type of blow, if you will, at the unfortunate timing of the QRS interval. Now here you see him there. Now you see he's able to get up, and he could very well be dizzy right there, and he could be in a cardiac arrhythmia right there. So he never really gains full composure, and it's a very, very unfortunate situation here. I'm going to stop sharing the screen, but The important lesson, and again, my heart goes out to the family. My prayers are for Mr. Damar Hamlin's recovery. I don't know his condition at this time, but I think it's important for us to understand what's possibly going on here, and this could be a teachable moment for all of us. First and foremost, we have loved ones who participate in sports, be it volleyball, be it football, baseball, karate, judo, whatever the case is. In any of these sports, you have the chance of getting blunt trauma to the chest. In the event you see someone who has blunt trauma to the chest and they collapse, or any patient who collapses, then you should be ready to do CPR. First, you're going to check if they're breathing, check if they have a pulse, airway, breathing, circulation. So, check the airway, check if they're breathing, check to see if they have a pulse. If they, if you, hold the head up, you open the airway up, you can see they're breathing spontaneously, see if they have a pulse. That's the first thing. If you don't see if they're breathing and they don't have a pulse, then you need to, get help, start CPR right away and get help immediately. Have someone call 911. And you should also hopefully have an AED on site. If not, ask someone if there's an AED, but immediately start doing chest compressions and CPR, because that's going to be what gives that person a chance for improved survival. Oftentimes, individuals may slump over while sitting up. They should be laid down immediately. Sometimes, people pass out because they have a vagal spell, and vagal spells are benign causes of passing out. But if they're sitting up, they won't recover from a vagal spell, and they may start to have seizure-like activity. So when someone passes out, typically if they lay out flat and they're on their own, then you need to check to see if they are breathing spontaneously, have airway. If not, check the pulse, of course. And if you don't have a pulse, then you need to start doing CPR right away. This is something that's going to really impact the person's chance for survival. And so I'm seeing reports here. Thanks, Jimmy Homer. I heard that his publicist said that his vitals and they are back to normal. So thank God for that. Chris Cheatham said they did CPR for 10 minutes. And I understand, and let me know in the chat if they did defibrillator. I heard that they used the defibrillator on him, and I'd be curious to know how many times he was shocked. So I'll go online and look for more information and try to give you. But my primary diagnosis is, and again, I can't make a diagnosis, but my impression, I should say, just looking at the video, is that Commotio Cordis is something to be considered. It's an electrical abnormality that causes an abnormal electrical event due to blunt trauma to the chest. And it's something that we really need to be alert to. I think that AED should be at every sports arena, and anyone who is a coach or observing a game, if you see an athlete collapse, certainly if you're in a position where you have to take charge, one thing you need to do is make sure you evaluate that person for cardiac arrest. That's going to be the number one thing that's going to, cause them to have a bad outcome, is a cardiac arrest on the spot. So I will be back perhaps tomorrow, some later time, God willing, to give more explanation as I get more information. And again, some of the other things I mentioned are, to be considered. Hypertrophic cardiomyopathy, for instance, long QT syndrome. However, Commotio Cordis is at the top of my list of possibilities. And it's something that we should all be aware of. And we should be alert to, especially if we have loved ones on the sports field. So that's all I have for you. Thank you for joining at this late hour. And until next time, keep it fresh, natural, and alive. One thing I will say is that the Fresh, Natural, Live show will be changing its venue. I'll give you more details later. This is not the last you've heard from me or the Fresh, Natural, Live crew. We've been busy working on the new format But either way, give us a thumbs up, a like, a love. Please share this information with anybody and everybody, because I think it's important information for us all to be aware of and to be alert to. Till next time, I'll see you later.